I appreciate you being here. My name's Chris Dale. I'm a pulmonary and critical care doc here at Swedish, and also have the honor of serving as the Chief Medical Officer for acute care, so taking care of our hospitals. And I'm joined by a number of my friends to talk about a topic that unfortunately is still on our minds. I think we probably wish it was in the rearview mirror, but we get to talk about COVID and how things are going. So maybe, John, you might introduce yourself.
Hey, thanks, Chris. It's great to be with everyone today. Thanks. I'm John Pauk, one of the infectious disease doctors at Swedish and the medical director for infection prevention, infectious disease. And I guess I wanted to say a little bit about the Delta variant that everyone's been hearing about in the news and kind of explain why it's such a factor in what's going on now. The Delta variant had first emerged, in India in the spring, and it's now spread to become the dominant strain of COVID throughout the world and throughout the United States. In Washington State right now, essentially almost all cases of COVID are due to the Delta variant. And the reason for this is because it has changes in its outside coating, the proteins on the outside that make it much more infectious. So it, rather than being relatively somewhat difficult to spread, it's now COVID strain is much more contagious, closer like chickenpox. Not quite as much as that, but it's much easier to pass from person to person because the amounts of virus in the nose and throat and airways of people who have the Delta variant is much higher. So as a result, what we're seeing a big surge across the country and in our state in cases, and also with hospitalizations. And I think a lot of this has also been driven by some of the backing down on some of the mandates and masking and some of the distancing over the summer with some of the changes as we tried to kind of get back to normal. But unfortunately, the Delta variant has put sort of it complicated that. So I think that what does this mean for people and maybe their health choices? I think it's important to realize that with Delta variant, that right now there's very widespread transmission going on in almost all communities, and that we need to really go back to some of our earlier safety behaviors. So I think that means for everybody in going back to being very careful of masking in indoor settings when you're going to be around people who are not in your household is going to be very important again, and that's been reflected by the current masking mandate that the governor of Washington put back into effect. And I think I would also say, even in outdoor settings, if you're going to be closely gathered in crowded areas or close to people who are not in your household sort of group, that you should consider wearing a mask there as well. And I think this also applies to vaccinated individuals as well, because we've seen with the Delta variant that while the vaccination helps protect a lot against infection, that we are, with some of the high levels of exposure that we're seeing some breakthrough infections becoming more common. So I think everybody should kind of go back to some of the safety behaviors that we were following before, given the change in circumstances. So I think one thing I do think is important with this in mind, is that we really need to focus on the importance more than ever of vaccination. So while we do see some breakthrough infections with the new Delta variant, that overall it still has some significant level of protection against getting infections. And what's more important is we see that when people do get infections, they tend to be mild, shorter in duration, and less severe. And so I think the important thing there is not to think, oh, well, some people who've been vaccinated get infected, so it's not really working. Actually, the data is very clear that it's very effective at preventing severe outcomes like hospitalization or admission to the ICU. So I think that with the FDA approving this finally for persons 16 years and older, it'll hopefully get some of the people who've been holding out on the vaccine to kind of go ahead and follow through and get the vaccine done. And I think we're starting to see some of that trend in our state and across the country of people who've been not vaccinated yet kind of starting to increase acceptance of the vaccination. So I'm hoping with the FDA approval, with what's happened with the Delta variant, and then some more experience we have with safety with the vaccine, that we can finally close some of those gaps. Because right now, it's really been very difficult. Right now, our hospital systems in the state and across the country are totally overloaded. There's very limited to no ICU beds in much of Washington State. Right now, this week, I've been on clinical service at Swedish, and I've been seeing many patients being flown in, coming from other areas because of the lack of hospital beds across the state. It's really heartbreaking to me because we've seen a lot of cases of people being flown in. They've been intubated. They're on ventilators or going to get very sick very quickly. And what's really striking is the very how almost all of these patients are unvaccinated, no vaccinations. So to me, it's very difficult and even harder than any part in the COVID epidemic as a caregiver to be taking care of these patients with a preventable illness and to have to talk to their families, to see them on ventilators, to see them dying. So I think as a caregiver, one thing I really want to stress is the importance of that the vaccine is very good at preventing this, and that really trying to avoid these sort of difficult situations and hospitalizations, intubations, and deaths that we're seeing, and to try to get the word out to family and friends about the importance of getting vaccinated. One thing I just want to say, if you look at our hospital population, right now we have about 90 patients in the hospital. Recently, we looked at the numbers, and of the patients, only about 10% of them were fully vaccinated. And of those, out of the 50 or so in the ICU, only 2 had been fully vaccinated, and both of those had problems with their immune systems that would expect them not to have responded. So the bottom line is that the vaccine, it works very well, was designed to do, and the more people that can get out and get it, the more importantly. And I think the other thing to mention to that Dr. Sorensen is going to see, we're also seeing other groups, younger patients, pregnant women who unfortunately are also coming with severe disease, and there's also been deaths. And so I think all the populations are people who've been maybe holding out. We really need to get everybody on board with vaccination. It's something that's really important given the Delta variant's effects and the amount of severe disease that we're seeing right now. So I think that's just sort of my plug for vaccination, a little bit about what we're seeing with this new variant.
Yeah, thanks, John. I mean, a lot of information there. It is I think a tough time to be a caregiver. I think, it's different now, or it seems different to me. In terms of, I think a lot of us, myself included, like we just kind of want to get on with our lives, right? We want COVID to be in the rearview mirror and for this to be a memory and for us to just like get back to, you said the thing about masking up if we're in crowded settings. And I was like, does that include like Husky games and Seahawks games? And which I think it does. But, you just want to get on with life. And I'm an ICU doc, and our ICU providers, though, and the physician APCs and the nurses, I think people are people are feeling tired. So I appreciate all the work of Washingtonians, though, to mask up and to do the things that we can do, like get vaccinated, in terms of helping find our way out of this. It's also having an impact, kind of this recent COVID flare is having an impact on our ability to care for people who have problems unrelated to COVID. And that's maybe something that's, I guess you read about in the papers sometimes, but, Dr. Simmons, you're an anesthesiologist and you help lead our surgical services team here at Swedish. I'm very curious from your perspective, kind of the impacts you're seeing of kind of this most recent COVID wave and kind of how it's coming to bear in surgeries and what we're able to do at Swedish to provide care for people.
Yeah, absolutely. Hello, thanks for having me. So the strains of COVID, both nationally and regionally, the increasing numbers are impacting our hospital, as Dr. Pock mentioned, and it's requiring more labor-intensive care. So that really does impact our ability to provide elective surgical care. And I joke with that word elective because the majority of our surgeries are not elective. People have illnesses that they need to be taken care of. But because of the strain on our hospital right now, we're evaluating our resources every day to perform certain surgeries. We've stood up locally a multi-specialty surgical review committee, and we meet once a week and multiple times in between, and we review every inpatient procedure and surgery that needs to happen at our hospital, and we prioritize them. And this has been unheard of prior to COVID times, but we have so limited resources in terms of nursing care, techs, floors, beds, that we have to do this, and we prioritize the patients. And for us, an inpatient surgery is any surgery that requires a nurse or a tech outside of the OR and outside of pre-op and recovery room. So, I mean, I would echo what everyone is saying here. To get vaccinated not only helps our COVID numbers, but it allows people to get routine care, such as knee replacement, such as their cancer surgery, bowel surgery, hysterectomies, really medically necessary care that we have to triage right now.
Yeah, that's got to be a kind of a frustrating thing for, on both sides, right? For the physicians who really want to, and the surgeons who really want to operate and help people, and then patients who are needing care.
Absolutely. I mean, when you schedule a surgery, you plan your life around it. You get people to come help you, you take time off work, and then to have to hear that that's going to be postponed and not knowing exactly when, that is really hard.
Yeah.
So I feel for them.
Oh, 100%. And I appreciate all the work that you and Dr. Horton, who helps lead also surgery, have done, along with so many surgical colleagues, in terms of trying to make wise decisions around this. Because really, Swedish, like, we love to be able to care for everybody. And in this case, with, just so many Washingtonians getting sick, both here in King County, but also outside, we got to do this balancing act. So it requires a lot of very thoughtful work to try and meet the needs of our community. And that's, something that makes me proud actually to be a Washingtonian, is knowing all the work that is done to coordinate care across the geographic areas. And I think a lot of people don't know that Washington State has a very, very good infrastructure in terms of the health systems all working together. We never compete on patient care. That's like the furthest thing from our minds. And we're all working to make sure that where there are specialty services, so-called tertiary or quaternary services, that they remain available. And it actually brings up something, Dr. Tanya Sorensen, you lead our OB work here at Swedish, and we do a lot of very specialized OB work, and there's been a lot of impact of this recent COVID surge on women, particularly pregnant women. I wonder if you could share a little bit about what it's been like. I know you're working today clinically even, so I appreciate you taking the time.
Absolutely. Yeah, thanks. Just as John was saying, we have seen many more pregnant women get really sick, and it's been something that we had prepared for a year ago, and it didn't really materialize. But now we're seeing, 4 or 5 patients at a time in our ICU in the region. We have people hospitalized. We've had maternal deaths. We're having to deliver babies prematurely so their mothers can breathe, and that's not good for the babies either. So it's been pretty heartbreaking. And as you say, with a vaccine available, and actually quite the majority of pregnant women not yet being vaccinated despite recommendations, it does a little, it feels really sad. It's also a real strain on our resources and our people. Our nurses are working really, really hard. They're going in and out of rooms with patients with COVID is not an easy thing, with the PPE and everything you need to do. And we really have a nursing shortage in the nation, and we definitely feel that here as well. So there's treatment available, which there wasn't so much a year ago, but the treatment isn't always effective. And really, it is absolutely essential, especially for pregnant women right now, to get vaccinated. We know that we recommended the vaccine for a long time, but now we have a lot of data that says that it's safe. It's safe and effective, and it doesn't cause any disease, and it doesn't cause infertility. It doesn't cause any of the things that people are worried about. And in fact, when you get the vaccine, you may be protecting your baby as well. Women who are breastfeeding, we've found antibodies to COVID in their breast milk. And just like with pertussis, when women get a booster for Tdap towards the end of their pregnancy, it's to protect the baby as well as the mom. So I think we just need to get the word out. I feel a little, I'm grateful that we can discuss this here, but I feel all of us are feeling a little at a loss that people don't see what we're seeing, don't understand how impactful this is in pregnancy, and how, it affects a mother, a baby, and an entire family.
Yeah, and to me, it's just so sad that pregnancy is such a precious and treasured time, and people are trying so hard to make good decisions. And you go onto the internet and you read, this thing, and you read that thing, and you talk to this person, you talk to that person. I appreciate your guidance, and I guess maybe just to come back to it just briefly, if I'm pregnant, and let's say I've had one shot, or maybe I haven't been vaccinated at all. Just so we're super crystal clear on it, are there, amongst kind of OB professionals, or your OB professional society, are there any dissenting voices, or is there pretty strong unanimity around the recommendation to get vaccinated?
It's really unanimous. The American College of OBGYN, the Society for Maternal Fetal Medicine, the CDC, Providence as a whole, I lead the maternal fetal medicine group for Providence. We've got the word that everyone should get vaccinated in pregnancy, that it's safe, that you can have it anytime during pregnancy, that you can have it at the same time you have your other vaccines, all of it. Anytime you can get that done, you should get it done. If you've had the first dose and then you get pregnant, you have the second dose. And if we get to when we get to the point of boosters, I think that people who qualify for them also should not wait until they deliver. They should get them while they're pregnant for all the reasons we just talked about.
Yeah, I appreciate that. Well, that brings us maybe back up to John, and I see Christina Garcia Holmes. Thanks for putting a question in there. And if others have questions, you can feel free to chat them in. But she asked about any information on transmission rates amongst those who are vaccinated. And I guess kind of a corollary of that, like, I think you touched on it briefly, but what are we hearing about booster shots? I read today actually in the paper that it's not 8 months, but maybe 6 months. And it sounded like that was a leak from some confidential source inside the CDC or the White House or something like that. But what's the current thinking around booster shots, and when are people going to be able to get them?
Yeah, so I think the thought is that there is some evidence that with some of the mRNA vaccinations that, Pfizer and Moderna, that over time people's immunity may wane, and theoretically a booster shot would boost that up and add to protection. So we haven't seen final guidance on this from the CDC or the American College of Immunization Practices, but we expect they'll be coming out soon to recommend that people towards the end of September start getting boosters. And we're expecting that would be roughly around 8 months after the second dose that they've received, and that we're going to, given the huge number of people this involves and the complexity and prioritization, they're likely going to target high-risk groups like healthcare workers or patients who live in long-term care facilities first, to try to get those populations addressed in a sort of a prioritization manner like we did initially. But I would anticipate that over time, the recommendations people will need that booster. I think overall, there's still a significant protection against the Delta variant and over time, but that there is probably some waning. A lot of it's hard to separate from how much of it is the fact that the Delta variant is so much more infectious, why we're seeing some more breakthrough cases in the vaccinated population. So I think that's probably a more important factor than the actual waning of immunity, but they probably are both at play. And I think that, So I think overall, though, that the important thing is, even though we are seeing some of the breakthrough infections, a lot of them tend to be from really high-level exposures in the household. That where the as opposed to just more like lower-level exposures from just being out in the community, taking careful practices, like masking and distancing. So we'll have to see what comes out with the recommendations, and we expect those to come out in the next week or two, and then we can start to kind of have more of a firm plan for how we'll address boosters.
Yeah, no, I appreciate that. It's interesting, kind of, I don't know, sad at some level. This whole thing has become so like controversial or politicized. I don't consider myself a very political person, but it seems like this, I don't know, for some reason it seems very divisive as of late. And so I just appreciate both you and then, Tanya before about about pregnant women providing just very clear, scientific based evidence. So, I thank you for that. We can turn some other kind of comments here, or questions in the chat. I appreciate Jasmine Myers talking about saying how tired folks are and just thanking healthcare workers for doing it. And I share that, that to see, kind of nurses or others providing care for patients who have to, because of the severe COVID illness in their lungs, like be on their belly and be turned so they don't get pressure ulcers or break down sores on their face or elsewhere. It just takes so much work, and it's and people are tired and they are frustrated. So I appreciate you acknowledging that. And then Terry Kuti, I appreciate you calling out breast cancer survivors and the breast cancer community. And that's, I think, maybe Aruj, kind of coming back to you for that a little bit, is one of the questions that we actually had a meeting earlier today with all the leaders of surgery amongst Swedish. And I think one of the questions that came up from one of the orthopedic surgeons was, hey, I know that we're postponing people right now because of this COVID wave. Like, who are people who've had surgeries postponed? When are they going to be able to get their surgeries done? Is there any kind of thought or guidance that we have at this point in time about rescheduling stuff? Because I know people have a lot of things they put off.
Yeah, absolutely. The number of times I've heard "look into your crystal ball" over the past 2 weeks has been a lot. I think the reality is it's going to be, as a community, how many people we get vaccinated, how we go back to what Dr. Pock mentioned about wearing masks inside and outside and social distancing and being careful again. Once our numbers in our community and our region can drop down, then we can start using our resources back to surgery and start rescheduling all those cases. And when we come back to that, hopefully sooner rather than later, we will get creative on how we do those cases. It'd be great to spread them out, even Saturdays and Sundays if we have to really, because we know there's a lot of patients waiting. Just every time we go over that review committee, it breaks my heart a little bit because there's so many patients who need surgeries.
Yeah, and I appreciate that's something we all can do. I mean, it's like kind of coming back to the same point again and again, but that's something we all are doing to help serve fellow Washingtonians is vaccinate, encourage our loved ones to get vaccinated, because that's allowing us to keep surgeries going for people who need surgical procedures and have capacity to care for, the sick pregnant women coming from elsewhere. Like, it's really, I forget who just said it, but like, if people could see what we see, like, I think that would be something to let them know. I guess to that end, I think we have a graphic on where to go to get care. I don't know if we can flash that up or not, but one thing to let people know about is we're really trying to keep the ED kind of free and reserved for emergency care. And so Swedish is happy to have other sites of care, from primary care clinics to urgent cares, that people who have less urgent needs can go to for care. So I just want to kind of get that point in there, just that we're really trying to be here for you, and when you're sick and when you're less sick, be here for you in other places. So, all right. And we got one last question here from Dodie Mills. I appreciate you asking that. And then we'll kind of wrap it up here. But John, maybe you can cover this one about transverse myelitis.
Yeah. So, as far as to the best of my current knowledge, there's not any reason if you have transverse myelitis to not get vaccinated. But I would say that'd be an important thing to talk about with your daughter's, caregivers who really know her case well. And I would imagine that with some neurologic conditions like that, that there may be some more vulnerability to the effects of COVID. So I would say at this point, that to look at which vaccine would make the most sense and have a talk with her provider. But I'm not aware of any reason why that would be a contraindication to getting vaccinated.
Well, and potentially the opposite too is that, I don't know obviously anything about the details of her care, but if people have a neurologic condition for which they're on immunosuppressive agents, like, that's a particularly vulnerable population. I think, John, you were mentioning that in the ICU, what'd you say, the people who are vaccinated and in the ICU, did you say that all of them, I guess, they had immunosuppressive conditions? Is that right?
Right. I think that, the couple had reasons why they would not respond as well to the vaccine. And I think that's one reason why we're recommending that people who are immune compromised get a 3-dose series now to kind of help boost that. That appears to be really effective at getting that immunity higher. So I think the vaccine does still work in people who are on immune suppressive drugs, but also those people need to continue to be more careful with their precautions too, even if they're vaccinated.
Yeah. And again, not to come back to it again, but because it's hard to predict walking through Safeway who has an immunocompromised condition or is on chemotherapy, like, another reason how we can serve one another by getting vaccinated. All right, let's. Pinky Rara, thanks for putting in a question here. Maybe let's see here. What is our thought around those individuals with immunocompromised conditions such as Crohn's or various heart conditions or allergies? Varying thoughts on what providers are saying in terms of vaccination. So maybe, John, do you want to cover that, and then we can
Sure.
We'll wrap up.
Yeah, so there are really only a couple major reasons not to get a vaccination. One is a history of severe allergy to the COVID vaccine, or a history of a severe life-threatening immediate allergy to one of the components of the vaccine. Otherwise, there's really no other significant contraindication to getting the vaccine, and almost everybody could be a candidate. And in particular, there's really no evidence to think that people with immune compromise shouldn't get it. It's not a live vaccine. You can't get COVID from the vaccine. And we know that people who are immune compromised are much more likely to have severe problems from COVID. So there's really no reason for people not to get the vaccine, other than those real severe allergy ones that were mentioned.
What if I have an egg allergy?
That is not a contraindication.
What if I just don't like eggs? What if I don't like eggs? Okay, I can still get that. No, okay. All right. Well, thanks, John. I appreciate that. Dr. Simmons, do you have some closing thoughts for folks on COVID and the surge and surgeries?
Well, I don't want to beat a dead horse, but I would say get vaccinated and be careful. I mean, this is all what we do for ourselves, and we do it for the pregnant patients and the immunocompromised patients. Vaccines aren't just something for yourself, it's for your community.
I like that. Vaccines aren't something just for yourself, they're for the community. I like it. It's like caregivers caring for caregivers. I like that too.
Yep.
Dr. Sorensen.
Yeah, I think I'm sort of going to echo what's been said, but pregnancy itself is a immunocompromised state. Pregnant women are more likely to get infections in general. And so those pregnant women who have other conditions such as Crohn's and so forth, as Pinky was saying, have even more reason to get vaccinated because they are much more likely to get much more sick. And so I just want to, again, I'll say it again, get vaccinated. My patients need you to get vaccinated, please.
Awesome. Well, thanks very much. Thanks for being here. It looks like, we got one last question in here. Should someone who already had both the Moderna shots, like fully immunized, get another booster? And I think as John was saying, booster time, and thanks, Tina, for asking that. Booster time is coming. I've heard September 20th or so for people who had the vaccine. It'll be 8 months, 6 months. I don't know. I think more to come in terms of the time from the last dose, but there'll be more information coming in this evolving situation, but boosters are on the horizon. And with that, thanks everyone for being here. Spend a little bit of time around the noon hour with us. Appreciate being able to serve you, and thanks very much. And thanks to Drs. Pauk, Simmons, and Sorensen.
Thank you.
Thanks.